Divorced beheaded died, divorced beheaded survived, well, only by about a year and a half. Let's talk about Catherine Parr, who was the sixth of Henry VIII's wives. Now, Catherine married Thomas Seymour, who was the brother of Jane Seymour, who was Henry's third wife, and also the mother of young King Edward VI. Catherine became pregnant shortly after her secret marriage to Thomas, and as far as I can tell, this seemed to be a fairly uneventful pregnancy. But tragedy struck only a few days after childbirth, after she gave birth to their daughter Mary. Catherine ended up passing away 5 days after due to childbed or puerperal fever. Childbed fever is an infection of the reproductive tract that happens during childbirth. It typically onsets a few days after birth, and it's accompanied by symptoms like a fever, based on the name, abdominal pain, as well as purulent discharge. Now, today we know what the cause is. It's bacteria that's introduced to the reproductive tract during childbirth, usually by medical interventions made by birth or medical attendants, and we treat this infection with antibiotics. We also go to great lengths to actually prevent this from even happening, and that's by maintaining good hygiene during childbirth. And this was all instituted by physician Ignaz Semmelweis in the 19th century, though that's a story for another video. Anyway, for Catherine in the 1500s, she did not have access to this kind of medical knowledge or care. Of course, physicians and midwives have recognized for millennia that childbirth is laden with complications for both mother and child, and they've also recognized the phenomenon of postpartum childbed fever, whatever you want to call it. Unfortunately, there wasn't much to be done for it. In the 16th century, physicians still believed in the humoral theory, which was about optimizing the balance of the four humors in the body. And this is why many physicians turned to things like bleeding or purging as an approach. Unfortunately, I don't think there was much to be done in Catherine's case, and I think what amplifies the tragedy of her passing is that her daughter, Mary Seymour, also probably passed away by the age of 2, although there is some controversy about that. The reason I'm even talking about this is because I heard about Firebrand, which is this new movie about Catherine Parr, and I don't know if they're going to cover her death in the movie, and I don't know how historically accurate or inaccurate it is, but I'm definitely gonna watch. Before we finish this up, I want to note that Catherine was not the only one of Henry's wives to actually pass away from childbed fever. Jane Seymour, his third wife and mother of King Edward VI, also passed away from childbed fever. Another member of the royal family also passed away a few years later, and I will say, spoiler alert, if you're a fan of Bridgerton, maybe stop watching here, but that ended up being Princess Charlotte, who was the daughter of George IV, who was the son of Queen Charlotte and King George III. Princess Charlotte passed away a few days after giving birth to her stillborn son. So come back for chapter 2, where we talk about the maladies and the deaths that befell the 5 other wives of Henry VIII, and follow for more medical history.